Hello, everyone. My name is John Vokel. I am an MBA student at DeVos Graduate School here at Northwood University. I am also the first place winner of the 2019-2020 Bowervic Essay Competition, and I will be moderating today's discussion. So thank you for everybody here that's joined us to listen to the discussion. I'm very much looking forward to it. Quick housekeeping item. On the right side of the screen, you should see a little Q&A icon. You can go ahead and throw in your questions during the discussion there, and then in the last 10 to 15 minutes of the event, I will circle back around to those and try to ask some of those questions. The ones that we don't get around to answering, we will do our best to answer at a later point. Without further ado, I'm going to go ahead and introduce our panelists. So first, we have Dr. Dale Matchek. Dr. Matchek is a professor and chair of the economics department at Northwood University. He earned his PhD in economics from Cornell, and he's the co-author and editor of When We Are Free, which is an anthology of essays describing the values and functioning of a free enterprise system. Next, we have Professor Jim Hopp. Professor Hopp is the chair of entrepreneurship and franchise management here at Northwood University. Before Northwood, he witnessed the free market at work as an investment banker working directly with entrepreneurs, an executive for a manufacturing company, and the part owner of a medical audit service. Professor Hopp earned his MBA from Northwood, and he is also a small business owner recently taking part ownership of Midland's Bigby Coffee location. Finally, we have Michael Van Beek. Mr. Van Beek is a director of research for the Mackinac Center for Public Policy. He has authored several studies for the center, as well as analysis and commentaries that have been published in the Wall Street Journal, the Detroit News, and the Detroit Free Press. He recently authored a report on the history and use of Michigan's emergency powers laws. So I'd like to thank the three of you for joining me today, and in the interest of time, I think we're going to get rolling with questions. The first question I have is for Dr. Matchek. Economics is a study of trade-off and choice. I want to know if you believe that the lockdown was necessary to stop the spread of the disease and what the trade-offs were to making such a decision.
So, was the lockdown necessary? No, that's the simple answer. However, social distancing was absolutely necessary. And it turns out that the lockdowns did increase social distancing to some extent. But I want to emphasize the fact that many people were hoping for a kind of eradication of the virus, and that was never an option. Initially, the lockdowns and the social distancing measures were rationalized as a way of preventing hospitals from being overrun, and I think over time that what had evolved into, well, let's save as many lives as possible. And I think that's why some of the lockdowns became as widespread as they did. One of the things that I want to emphasize is the fact that for those that are thinking that we could have avoided the economic pain by avoiding the lockdowns, that doesn't seem to be true. A lot of the economic pain would have been experienced with or without lockdowns. And I'm reminded of something that Thomas Sowell says, the great economist at Stanford. He says there's no such thing as a solution. And that's certainly true of this problem, COVID. No such thing as a solution, only trade-offs. But some trade-offs are worse than others. And I think the lockdowns unfortunately pushed us into some territory where the trade-offs were pretty poor. Considering the benefits of the lockdowns compared to the costs, those trade-offs didn't work out very well. So just to give you an example, some people have characterized the lockdowns as lives saved versus the economy. That's not the right way to think about it. When you start thinking about some of the trade-offs, you have to remember that, well, as an example, there are probably going to be at least 30 million people worldwide pushed into dire poverty as a result of the disruption to the global economy because of the epidemic. So when you're pushed into poverty, your life expectancy drops significantly. Something like that is what we're really looking at with respect to these trade-offs. The social distancing comes at a cost, and the people who bear that cost are often the people who are at least prepared to do so. What I'd like to do, and maybe later I can do more of it, I'd like to talk about what we could have done instead, which is targeted, in particular, vulnerable populations, relied more on personal responsibility, and I think we could have obtained much the same outcome with a little bit less economic pain, a little bit less loss of income, and frankly, life.
Thank you for that answer. I definitely think human behavior could have driven this a lot more than lockdowns themselves. As you said, social distancing was something that had to happen, but we could have driven that, more in a free setting.
Yeah.
I think my next question is for Professor Hopp, and this is kind of, discussing what makes a business essential or not. What deems a business or an employee as essential? Who gets to make those decisions? And can that help or hurt certain players in the market system by whether or not they are deemed essential?
Well, thank you, John. And before I answer that question, I did want to say thank you to the Mackinac Center, Northwood University, and the Bowervick Foundation, along with great friend Pat Leonard, for putting us on today and allowing us to talk about this really important topic. So the whole idea of essential, right, came to the forefront 10 months ago. You were either deemed essential or weren't deemed essential. I actually looked it up. There are 14 different categories of essential businesses as required by the government. And I'm not going to go through all of those, but what I would like to say is, look, are you essential to operation of the country? Okay, I get that. Healthcare workers, different things. What I think is more important to consider is no one wants to be considered not essential. Of course, we consider ourselves to be essential, and I think one of the things that we've sort of lost sight in here is that when you're deemed to be non-essential because you didn't fit a category, it hurts self-esteem. It hurts the things that you believe in, the things that you do. And really, when it comes to small businesses, one of the reasons people get into small businesses, they're following their passion, their interest, they're bringing a product to the consumer. And to be told that what you're doing is not important, it's one thing to be told by the customer, right? The customer says, I don't like your product, I don't like your customer service. I have to accept that and move on. But to be told by the government, you're not essential, I think it was one of the difficult parts. For small business owners, for entrepreneurs, their association with their business and their personality is lockstep. In so many cases, you are that business, and that business is you. And so again, the whole idea of are we essential? I think hurts us from an ego perspective, and it hurts us from a productivity perspective. And so I don't like that term. I think what we have to look at is look, in a free market enterprise, right, in a free market society, the consumer is going to decide whether you're essential or not, whether the product or service you're providing is important. And if they're not coming to your business, that's one thing. But when they're told they can't come to your business, this is where I have the biggest frustration. Let me operate in a system where people make individual choices and we live to individual responsibility. I understand that not everybody is going to do things the way we want them to do it. But if we don't believe in the individual and the individual responsibility, then we might as well let government tell us when to wake up, when to go to work, if we can go to work, what we can do. And look, I don't think anybody here wants that, unless you're in the government. Maybe you want that. So I think that the essential title was a poor choice, was a bad choice. I think we thought that was going to be short-lived, and here we are 10 months later, still sort of talking about that and picking and choosing, right? Oh, I'm going to let this industry go back, but I'm not going to let that industry go back. And I've got some stats and figures, and hopefully later on we can talk about what industries were hurt and what ones weren't. I think that might be a future question. But the lockdown hurt many people. And to Dale's point, I think Dr. Metrick is right. COVID was going to impact the economy, but how we approach this is my biggest concern. And I will take this opportunity to say one of the things that I've been thinking about for the past 10 months and that really I'm interested to see where we go forward is this our game plan now? Because this is not going to be the last time we get hit by a COVID-19. COVID-20 or whatever we want to call it is going to come along. And quite frankly, I believe our economic enemies see this as an opportunity, right, to hurt the greatest economic engine on earth. And I'm really concerned about how we finish this one and approach the next one. So hopefully we don't use the term essential employees, and hopefully we figure out a better way to work through this.
Oh, I think I might have cut out there for a second. Sorry about that. My next question is to Mr. Van Beek, which are discussing the legality of the orders that we have. So pertaining to Governor Whitmer's orders last year, and then kind of what has turned into orders from the health department, are these legal? Are they actually permitted to pick these winners and losers and do it for extended periods of time?
Well, it's a great question, and one that the Mackinac Center sued Governor Whitmer on this issue, and the Supreme Court ruled that her actions, the emergency powers that she used, were illegal and unconstitutional. So Governor Whitmer relied on two laws to grant herself emergency powers and unilaterally issue orders that individuals must comply with under penalty of law. One of those was written in 1945, and one was written in 1976. The 1945 law was meant for local civil disturbances like riots, and had only been used about a dozen times in Michigan's history, mostly for riot-like situations. The Supreme Court, when we sued, ruled that law, the 1945 law, was unconstitutional because it essentially delegated unlimited power to the governor. It was worded so broadly, or you might say so poorly, that it could be used for just about anything. And the governor was solely able to determine how long those powers would last. So the inherent problem with this law was that it didn't provide any guardrails on the type of power that a governor could use while declaring an emergency. And this law was on the books since 1945, so you might think, well, it's tried and tested. But the reality is no governor had tried to use this law in such a broad way before. And so Governor Whitmer's unique use of this law was what made it unconstitutional. But in addition to that, the Supreme Court also unanimously ruled that the governor's use of the 1976 law was also illegal. That law says that the governor may declare an emergency and may issue emergency orders for a period of 28 days. And after 28 days, that power, that emergency order goes extinct unless the legislature approves an extension. And with COVID-19, the legislature did approve an extension after the first 28 days, but that extension ran out on April 30th. After that, the governor tried to continue to use that law without a legislative extension. And the court unanimously said that was also a violation of the law. Now we have new orders in place that come from the state health department. These are epidemic orders. And these are in a different law in statute, the public health code. We don't really know yet. These haven't been challenged in court sufficiently yet, but they are. But if you read the law, it's very similar to the 1945 one. It essentially allows the director of the state health department to do just about anything for however long he or she chooses. And also, like the 1945 law, these powers have never been used before in this way. So there is still a lot of uncertainty about whether or not those epidemic powers and the orders that are currently in place are legal. I suspect that we will find that out in the future as these laws continue to be challenged in the courts.
I guess just a quick follow-up to that is there anything down the pipeline for the Supreme Court right now that will be making its way up shortly here?
There are cases that are in the courts, but none of them that I know of that are kind of on track to get up to the Supreme Court. The Supreme Court also changed partisan makeup. So it used to be used to be controlled by Republican nominees, and now it is majority Democrat nominees. So it's less likely that Democratic Supreme Court justices will rule against a Democratic governor. So that law is less likely to be scrutinized in the same way that the 1945 law was.
Awesome, thank you. My next question is circling back to Dr. Matchek. The question is, how does Michigan's response differ from other states or countries, and what can we learn from those comparisons? I think Sweden's a good example that comes to mind just due to their similar population size.
Mm-hmm. Yeah, so Sweden is a good example, and there are also examples within the United States. As it's been said, the states are the laboratory of democracy. And so, I mean, the gold standard, if you wanted to find out what the economic effects of the lockdown are, you'd have an experiment with a control group where there were no lockdowns. And we don't have that, but we got something similar to that where we've got different policies in different states. And even then, you've got to be careful when you're drawing comparisons. Some people have looked at Sweden, which had policies that were quite sensible in my view, but they had a lot of COVID deaths that some of their Nordic neighbors didn't have. And so a lot of people, well, they attributed that to the fact that Sweden didn't lock down. I don't think there's a direct connection when you look at the raw numbers like that. To me, a much better systematic look at the effect of lockdowns happened right here in the United States, where some economists looked at the border between Illinois and Iowa. Now, Iowa had a no lockdown policy. Illinois had a lockdown policy. And by looking at counties at the border before and after the lockdown that were similar prior to the lockdown, they saw the decline in business activity and COVID cases in the two situations. So in a population of more than 400,000 people, this study estimated that the lockdowns in Illinois might have prevented 200 cases of the COVID compared to the non-lockdown state. Given the fatality rate that we know of COVID, that's about 3 lives. Now, 3 lives per 400,000 people may sound like a lot, but when you consider, for example, the risk of driving on the highway, where the fatality rate is about 3 in 100,000, that's much lower risk, for example, than driving. So the lockdown had a very little effect on the extension of life, but what they did see, is that it had a big impact on employment in the two situations, where there was a much larger reduction in employment and income on the Illinois side of the border. So most of the life-saving social distancing was actually happening on both sides of the border. And what happened with the lockdowns was it just kind of put some activity out of reach for people. So you can imagine, here in Michigan, for example, closing the golf courses. Did it save lives? Highly unlikely. Did it put people out of work? Absolutely.
Thanks for that. And it is good to know the quality of living between the Iowa side and the Illinois side there, and that can definitely attribute to deaths indirectly in many ways. So that's definitely interesting to look at that little case there. My next question is for Professor Hopp. And that question is, if the government left it up to private innovation to combat the pandemic, would things look different right now?
So that's a good question. And so I'm going to relate back to a couple of examples from the past where I believe that's been true. So in the innovation of flight, the U.S. government actually gave money to and contracted with Samuel Langley to develop flight in the United States. And 2 bicycle repairmen or bicycle shop owners from Dayton, Ohio, were the first 2 guys to get it off the ground. And the very next day, Samuel Langley quit that and moved on to his next thing. So just being government funded, just being pushed by the government doesn't always get you there, right? Now, certainly there's a profit motive, and you might be saying, well, wait a second. profit motive. We need to take care of a pandemic. There shouldn't be a profit motive. But innovation happens because there's a desire by the consumer. So if we want to look at a pandemic and say the consumer is everybody, right, then absolutely private enterprise is going to be incented to fix it. We can go back to World War II, right? Detroit became the arsenal of democracy. Automobile plants were changed to tank plants. And yes, there may have been a government order to do that, but they did it, right? And they converted, and we became the arsenal of democracy. And more recently, during this particular pandemic, we saw businesses who completely changed what they were doing to build sneeze guards, right? Safe plexiglass guards. They shifted their business model to help where help was needed. And they didn't do that because the government called up and said, hey, we need you to make these guards. We saw alcohol companies switch over to make hand sanitizer. And so I think across the board, you can see where private industry absolutely turns on the jets, if you will, and says, hey, we're going to come to the rescue. We're going to take care of this. And we don't need government to tell us to do that. Now, some government funding, some government direction, a good thing? Sure, it can be. Certainly it can help in distribution. But again, I think we can look back at history. We can even look at what's going on during this particular COVID situation and see where private industry has continually stepped up without being asked, right? I think good entrepreneurial business owners understand the need, they listen to the need, and they go meet the need, right? That's what free market is, right? And it's not just one, a bunch stepped up to do it. And so I think that's just I think that's kind of the heart of America, right? Is that when there's a problem, we come to the rescue, and private enterprise does that. And without it, we'd be in big trouble, right? It makes up 99% of the businesses in Michigan and half the employment in Michigan. And again, so we can see that across the board from a national standpoint and from a state standpoint as well. So, I would be hard fought to find a situation where government exceeded private industry in trying to accomplish a goal. And I might be a little biased, but that's just my viewpoint. I think private industry wins every time.
I don't know if I can add anything to what Jim just said.
Go for it.
But, I do think in this case, private industry was prepared to do a lot more and would have saved many, many more lives, except that many of the controls put in place by the CDC and the FDA slowed down testing and the development of testing. You can have cheap tests with instant results, over-the-counter type tests. FDA says you need a prescription for those. And by the way, you need to download an app to go with it that's going to monitor your movements. And they've got reasons for this because they're worried people will test positive and they won't tell anybody and we won't be able to trace it. But the fact is, if people had a way of determining that they're carrying this disease, they would modify their behavior. And I think this is a case where for a cheap and widely available test that you could buy for $5, that's a no-brainer for fighting the pandemic. And that's simply not allowed by our bureaucracy.
I think another interesting part about this too is that, the economic machine that we all have the privilege of living in has done a really good job of doing some things that has made pandemic life a lot more comfortable. And the first one that comes to mind for me is all of the grocery businesses that will deliver groceries to you. And I know there was kind of a business model, before the pandemic that catered to, but that sense has blown up. I mean, people are taking advantage of that every step of the way. And I think that's an amazing innovation that we get to, take advantage of during this time.
I'm just going to jump in quick here, John, and I've been teaching for 12 years at Northwood, and many times in the past, students in the entrepreneurship program, as you know, because you went through the program, get to put together their own plans. And I had many students look at that as an option, right? They saw that, but it wasn't as viable, right? As we looked at it, it wasn't cost effective, it wasn't viable, and people weren't willing to do it. And you're absolutely right. DoorDash, Shipt, all of these businesses have bubbled up to become major players now because people are much more willing to pay to have somebody deliver their product to them. And of course, we all know what's happened with Amazon and just, from their delivery service standpoint. So I think you're right. We have seen, as with all things like this, it creates opportunities. And in a free market society, people see those opportunities and take advantage of them.
Yeah, absolutely. I mean, it's great how the market responds to those things, right? And very, very quickly it becomes a major player in the market because there's a very massive increase in demand very suddenly. All right, my next question is cycling back to Mr. Van Beek again. Was the lockdown a violation of individual rights or a legitimate exercise of government's authority? And I guess I should follow that up with, at what extent does that gray area start to become more black and white?
It's a great question. And so was the lockdown a violation of civil rights or a legitimate exercise of government authority? The answer is it was both, because courts have ruled that a legitimate exercise of government is to violate individual rights, but only in emergencies and only temporarily. The question that courts need to eventually answer about COVID and the related lockdown orders that came along with it is, does a pandemic like this one justify a prolonged suspension of civil rights and a prolonged exercise of unchecked unilateral power by an executive? That's really the question. Courts have been hesitant to step in the way of executives issuing emergency orders and taking emergency type of action because they feel like, they have good reasons. Judges typically don't make rulings just based on how they feel. They have good rationale. But the rationale that has been established in case law is that those decisions in emergency situations are better left to elected officials. And it's sort of based on the idea you don't want to change horses midstream, especially if you're in an emergency. And so any sort of action during an emergency, whether it's the ideal one or not, might be better than the court changing that or causing some types of confusion or reversing those kinds of decisions. But COVID is really unique in that government officials have never attempted to violate our rights and exercise this type of executive power for such an extended period of time before in our history. So courts have a really interesting and new question to determine moving forward. And hopefully, we'll, as Jim alluded to earlier, this isn't the last pandemic that we'll likely experience in our lifetime. And we had one in 1957 and one in 1968. Fortunately, those weren't as severe as COVID, but we'll have pandemics in the future, no doubt, or similar types of health emergencies. And we need the courts to get this figured out because the type of orders and the type of civil right suspensions and violations that our governments have ordered are totally unprecedented. And I hope that the next time something like this happens, that we have better protections in place legally to preserve our civil rights.
Great, thank you for that. My next question is to Dr. Matchek, which is asking, what are some of the long-term consequences of the lockdowns? And, long-term, I guess, becomes a little subjective as we're coming up on a year into this, but what is the outlook going to look like 5 years from now, 10 years from now? Are the effects of these lockdowns going to still, be noticeable that far down the future?
Unfortunately, yes. So there are some effects that are going to be lingering effects, things that are already visible to us, that are already, causing some hardship. And then there are going to be some things that will appear as a consequence of this a little bit later on. But I want to be careful. As I said, I think most of the decrease in economic activity would have happened with or without the lockdowns. So I don't want to attribute all of these persistent problems to the lockdowns themselves, but to some extent because of the pandemic. So one of the things, and I hesitate to say this because I know there are a lot of young people watching who are going to be entering the job market for the first time shortly. But one of the well-known topics in economics is, does it make a difference whether you graduate into a recession or not? And it turns out it absolutely does make a difference. For most estimates, it's going to be about 10 to 15 years before the income of graduates at this point actually catch up to where people normally would expect to be after graduating from high school or from college. Now, as I said, a lot of that would have happened anyway. But as I also said earlier, a lot of this happened because the lockdowns imposed a larger economic cost than would otherwise have been the case. There's also a persistent effect for people who've lost their jobs. If you lose your job, there's a good chance that your labor force participation, especially for older workers, just stops altogether. So we should expect a lower labor force participation, less productivity. The other thing we have to remember is the debt right now is basically at World War II levels relative to GDP. But that's because interest payments right now are really low, and it's before this next stimulus package hits. So what is projected to happen when interest rates return to normal and all this additional spending goes through the economy is that we're going to get debt that is 300% of our annual GDP, which would put us way beyond any other period in our history, including World War II. So there's a kind of a double whammy. If you're graduating this year, sorry, you're going to have to be paying down that debt during your working life, the first 10 to 15 years of which you'll probably be earning less than the average grad. So these are some of the long-term consequences. There's also, unfortunately, a loss of life associated with this lower income and this higher unemployment rate. There's well-documented evidence. Economists call it deaths of despair, where the increase in poverty, it's expected to rise by about 6 million in the U.S., many of those permanently. The joblessness, the people who have lost their businesses. Now, I'm not saying all of that was avoidable, but to the extent that any of it was avoidable, it would have been much better for those people and for us.
I was going to ask somewhere in that question if we could anticipate an economic boom once the lockdowns are officially over and the pandemic effect isn't quite as bad as it is now. But that answer kind of gave me a pretty bleak outlook to that. Is there any possibility that we can see a pretty sudden increase and ramping up in economic conditions once these concerns are over? Or is it just kind of going to be a slow crawl back, kind of like the 2008 recession was?
Well, I'm going to share my screen with you for a minute. I'd like you to see, if I can, I'd like you to see the forecast from the University of Michigan's economic forecast. And it looks like, I hope that I am sharing my screen right now.
Yep, we can see it.
Good. So this is the University of Michigan forecast, and you can see this is the recession of the financial crisis, which was the biggest one since the Great Depression. And you can see that we have surpassed that with the COVID lockdowns. And this is their projections for the recovery. And you can see it's a rapid recovery. It's a quick bounce back, but it doesn't quite reach the former level, and it certainly doesn't get anywhere close to that trend line where it would have been. So, unfortunately, they are projecting a permanently lower level of economic activity. It's going to take more than a few years to get back. There are businesses, unfortunately, that are not temporarily closed, that are permanently closed, and it's not easy to rebuild an economy once it's suffered that level of destruction. So it's going to take some time.
I'd like to jump in on that question if I could, take it maybe a little more to a micro level from a business ownership perspective. There'll be a lot of things that people that don't have businesses won't see. And I think one of the things they won't see is people have taken their life savings and put them into these businesses. They're just hanging on by the skin of their teeth. If they make it through this, they will not have money to reinvest, to grow. They have taken years to hire employees. One of the most difficult things a small business can do is hire the right employee, train them, get them to live within the business like they own it themselves. And they may not be able to rehire those people. They're bringing them back. There's going to be a retraining process. So there's going to be less money to invest, a retraining process. Another one is all this unemployment insurance that's being paid for. Let's not forget, when the government funds something, right, where does the money come from? There's only two places, and correct me, Dr. Makchuk, if you would like to, but they tax us or they print it, right? So that's they're printing a whole bunch now in these stimulus packages, or they tax us. Unemployment insurance expense for small businesses is going to go through the roof, and it's going to be spread out over the next 3 to 5 years as they see their percentages increase. So again, additional dollars that may have gone to the bottom line for reinvestment are now going to be paid back to fill those coffers up, right? We can't keep printing money to keep paying people not to work, and those coffers are going to have to be refilled up. So people have already spent their life savings. They've been building a future, and they just don't have backup money to go tap. A good friend and mentor of mine pointed out back in March when we were going through the first 3-week lockdown, hey, every business should be in a position to survive a 3-week lockdown. And he was absolutely right? You have to put yourself in a position that some sort of economic hardship happens. But we're in month 10. And let's look at, for instance, the restaurant industry, right? I don't know anybody who'd want to be in the restaurant industry. So here's a quote from Governor Whitmer. She says, in talking of the restaurant shutdown, she says, the fact of the matter is the studies show that is where we've seen the highest risk. So in response to that, the Michigan Restaurant Lodging Association says state data shows a very small percentage of Michigan's coronavirus outbreaks are linked to bars and restaurants, to which she responds, well, that's likely due to a lack of contact tracing rather than evidence of outbreaks. So we're going to follow the science unless the science doesn't back me up, and then I'm just going to use conjecture and intuition. That's not a good place to be. And so what impact does that have? In the year 2020, the leisure and hospitality industry lost 205,000 jobs. 47% of those employed in the state are no longer working. And think about all those restaurants and small hotels. And if you've ever been to northern Michigan, right, where it's mom and pop, these are not big corporations. These are individuals. Where will the money come for the reinvestment, to rebuild, to add employees? It's to Dale's point, it doesn't just bounce right back. These employees may find other jobs. It's going to be very hard, and it's going to have a huge impact on these folks who don't have a reserve. The reserves are going to be gone. Go to the bank, go to individuals. It's going to be very tough. And I think that's something that will happen behind the scenes. And again, there's projections of anywhere from 20 to 30% of businesses may never reopen. And that's not just the restaurant industry. That could be across the board.
Yeah, that's staggering. That actually creates a decent segue into the next question that I had for you, Professor Hopp, which was talking about, like, after the pandemic is over, is this going to change the way that we look at labor and corporate structure permanently? Less of an incentive to invest into a brick and mortar office building that costs millions to lease out. More remote workers over in-person workers, the death of the 5-day 9-to-5 work week. Like, can we see all of these changes permanently happening after the fact, or do you think we're going to kind of return back to the pre-pandemic, work life eventually?
So I think, John, as with anything, it won't be 100% one way or the other, but I do think there will be many people who won't go back to a standard operation, if you will, won't go back to an office. I personally don't think everyone can work from home, right? There are certain jobs that you need to be present at. Not everyone actually has the mental capacity to work at home. And that probably didn't come out right, but my point is, some people just can't work at home, right? I like to come into my office at Northwood and work because I'm much more focused and I get more things done. There's too many distractions at home. And so I do think that will come into play. But yeah, it's going to change it. And so what are we going to end up with? A bunch of empty buildings? How will those buildings be repurposed? So that's bad. On the other side, the very interesting part is that could open up the door for many new entrepreneurial ventures to figure out use for that space. We've certainly seen changes in the retail front. Right? We continue to see retail businesses continue to fail and go away, and those spaces need to be repurposed already. So I don't know that there's a simple answer to that question. I do think there will be people who will continue to work from home. I think it's going to increase the need for IT folks, right? Because so many people are now, if you're working online, you need to have that good connection. So I think there'll be opportunities there. I wish I had a crystal ball. If I knew where all that was going, I'd be in great shape for the future, and I'd let you in on it as well. But I do think it creates opportunities as well as frustrations. Big-time contractors, right, may not have these large jobs to work on, but maybe they'll be working on repurposing. I think all those industries are going to look at it. Right here in Midland, right, Dow built a new corporate center, and they built another center right next to it. And it does make me wonder, will the folks go back to those buildings? Those are brand new buildings. They're beautiful buildings. And that's a large scale company. So I don't know that I have a great answer for that. I think we will see changes. I think it's a great entrepreneurial opportunity to look for ways to take advantage of repurposing those facilities and using your workforce different. One more thing I would like to say is the problem with the disappearance of the 9-to-5 job is when you work at home, when does your workday end? Right? And I think that's going to be something that as a society we're going to have to decide, and as a workforce we're going to have to decide. I always tell my students, when you answer an email for work at 10 at night, you now better do it every time at 10 at night or 1 in the morning. So you open yourself up for, hey, you didn't get back to me in 20 minutes. No, I was at home relaxing. I don't want to work all day long. And so I think it adds some interesting potential issues to our work-life balance, if you will.
Yeah, I can definitely say from experience that the number of late night emails from my boss has increased as a result of the pandemic in any work environment. Which, I mean, it makes sense. Things come up as needed, and people just want to get things taken care of to have a nice, even workflow. So I understand that. In the interest of time, I think I'm going to try to move on to some of the viewer comments that we've had so far. These can be fielded to anybody. I think this one that I'm about to ask would probably be best answered by Mr. Van Beek if he wants to answer it. This one comes from a former classmate, Parker, who asks, what steps should citizens take to ensure that these type of orders and this style of ruling isn't something that sticks around after the pandemic is over? Because this sets a very dangerous precedent for how government can dictate the way people live their lives. And we can, have a discussion about whether or not we had good reasons for doing that for the pandemic. But long after the fact, government has a habit of holding on to those powers for as long as they can. So how do we make sure as citizens that they tend not to impede on those rights after the fact?
Yeah, it's a great question. Fundamentally, we need to change our laws. Because it is state statute that has empowered government officials and government bureaucrats to issue these kinds of orders and to do these kinds of lockdowns. I hope that one good thing that would come out of COVID, this experience, is that more people would awaken to the dangers of the administrative state, to the deep state. It is large and it is powerful. And the types of things that are the agencies right now that are regulating every single thing, every employee interaction in a workplace, that's done through bureaucracy. The orders that are preventing you from having more than 10 people in your own home, that is coming from an administrative agency. So that we need to rein in the power of the administrative state. We need to put checks and balances back into the system and allow oversight and not allow unelected bureaucrats to make these kinds of decisions that can last for months and months and months and impact, nearly every interaction that we have in public. But fundamentally, we need to change our law, and we need more people interested in electing officials who will change those laws so that they better protect our civil rights in these kinds of situations.
Awesome. This next question is from Dan Goodell, and it's kind of talking about stimulus checks and universal basic income. And I actually was able to pull up some information that I had on that from a previous study I did, and obviously I want you all to jump in as well. But just kind of to start this off, we have spent roughly $3 trillion directly on COVID stimulus related issues. And most people are really unhappy with that figure because of the fact that the number of actual cash stimulus that went to their pockets was very little. By my math, you could have paid $15,000 in stimulus 13 with the amount that we spent on COVID stimulus, which I think is a lot more than the 1,800 than people got, and more than enough to weather these hard times, or at least it's much easier to go through those hard times with that sum of money. So could we maybe entertain the idea of cash payments on a monthly basis for all American citizens over 18 as an alternative to the way that we approach stimulus this year for handling the pandemic situation?
Very much oppose that idea for reasons that I kind of alluded to earlier when I talked about the effects of employment on mental health, life expectancy, and so forth. Employment connects you to the economy and your community and gives meaning, which is really the thing that is most important to anybody's mental health. So the idea that somehow if we just give people a certain amount of money and that's going to make everything okay, I don't like it. I think a much better approach is to figure out a way to give people, to increase employment. And, that's, if we're going to budget relief efforts, it should be in the form of wage subsidies or something along those lines rather than a basic grant. So I'll let the others chime in if they like.
I'll jump in. We've had this discussion in the classroom. For the most part, I'm against it. I've heard my students make actually pretty good logical arguments for it. Maybe it's just because I'm old school. I think you need to work for it. I think anytime you receive a handout, it changes your attitude towards the money, and we can see this in a parent-child relationship, right? When you're handed something, it doesn't feel the same. When you earn it, it feels different. There's an emotional bond there. And I can give you an example. Like when my son would want to buy a video game and we got to the point where I'd say, well, how much are you willing to put towards it? It changed the equation. Oh, well, it costs X. And I said, well, what if you pay half and I pay half? Oh, right. All of a sudden, is it so important now? And I know there may be a bigger argument for this, but I do think when you start handing out things for free and it becomes part of the expectation, it just changes a person's desire to work. And Dr. Matchek, I think you said it great, right? There's an emotional connection to working, and there's a personal feeling of succeeding that I think is very important. I don't want the government to babysit me. I want to earn my own way. And you know what? I need to figure out how to do that. And I do worry. Look, here's a perfect example. We started giving people an extra $600 of unemployment last year, right? And I talked to several business owners last year who said, my employees have called and said, please don't call me back to work till at least July 1st because I'm really enjoying this extra money. They were literally being paid more to not work than to work. When you take the incentive away from someone, I think it hurts the system. It hurts the employers, and it hurts the employees' attitude towards providing a fair day's work, if you will.
I agree with a lot of this on principle, and I think where this gets difficult is the business closures, obviously. Well, I could have worked, but things got closed down, and now I'm out on a job, and that's not necessarily my fault. So, what is the government going to do to remedy that situation? Another issue that stimulus doesn't solve is supply issues, right? You can have all the money in the world, but if people can't work to produce things, that money isn't going to take you very far, and that's another really important factor to consider. I think we have time for one more question here before we have to close things up. This one's from Wesley, and the outcome of public health has dominated the COVID conversation for nearly a year now. And often those who voice concerns about economy or personal liberty are dismissed as being callous towards those who suffer from the disease. And the question here is, how do we have a more rational dialogue without as much, emotions in the context of the discussion? How do we talk about some very serious consequences and trade-offs to lockdowns in a way that doesn't seem like we aren't respecting the idea that there are lives at stake here?
I can jump in first. It's not. I think Dr. Maychuk said this first. It's not just health versus the economy or lives versus the economy. I think part of the discussion has to be that they're joint together, and the fact that there are health consequences to lockdowns as well. So the good that lockdowns might do to preventing COVID deaths is counterbalanced by the public health damage that they do in and of themselves. So, we know that suicide rates are higher. We know that fewer people are going to get screened for cancer. We know that fewer people are getting preventative health care. We know that students are suffering in online classrooms and not getting the kind of educational services they need. So there are costs on both sides of the equation. So if one side isn't just unconcerned with public health, if you're 100% supportive of lockdowns, you've got to address the costs that come along with those as well. So it's really weighing all those different costs and making decisions about coming to decisions about how we can minimize all of those costs altogether, not just one single public health outcome.
Would anybody else like to chime in on that question?
Yeah, I'll chime in. I certainly don't want people to think, hey, I'm heartless and I only care about business and that's not true. Of course, I've got an 86-year-old mother who literally was able to leave her building for the first time in months. They were in lockdown, and I understand her frustration. I don't want her to get COVID. She doesn't want to get COVID, but her mental health was severely impacted by being in this one-bedroom apartment with, in many cases, the inability to even go out to the cafeteria, had to have food brought up. I get that, but there is an important mental health piece to this. In many cases, work does bring us joy. And then I'll go back to it because it's a big part of who we are at Northwood and for me individually. Individual responsibility. It's one of the beautiful parts about being an American, right? We have an individual responsibility to take care of ourselves and to take care of others and to make the right choices. Do we always do that? Of course not. Of course not. But I don't want government to take my choice away, my ability to decide for myself what's right. If I think restaurants are dangerous, then I'm not going to go out to restaurants. John, you pointed out yourself that we have seen an uptick in business in ship shoppers. Go into my area, you see ship shoppers all the time, right? People are letting others do things for them. It does create opportunities. Right, it's not an either or. We need to find a way to make it work together so that people can make individual decisions for themselves, and that we can keep health and at the top of the chart. But we can't just shut down businesses and say you're not essential. and maybe someday we'll let you operate again. It's tough. I don't want to see any more people impacted by COVID, but I also don't want to see people lose their livelihoods, lose their home, lose their mind. And literally we see that going on. So it's a tough trade-off, without a doubt. And again, not indifferent to it, just we gotta understand a way to make it work together.
Absolutely. I think that wraps things up for the time constraints, but I just wanted to thank all three of you for doing this and giving your input. It was a really great conversation. Hopefully it was great conversation for the audience to listen in on. And I'd also like to thank the audience for sitting with us for this hour and taking in all of that information. Additionally, I want to go ahead and plug the Bowervik Foundation and the 2021 Bowervik Essay Competition. I believe this year the essay competition is available to high schoolers as well as college students, and there is a cash prize for it. The topic of it is discussing, similar to this panel discussion, the consequences of COVID lockdown. So highly encourage those who are eligible and watching to consider writing an essay and submitting to it, because it really is an awesome cause. And then on top of that, you should be able to view this discussion on the Mackinac Center for Public Policy's website. We'd like to thank them as well as Northwood for putting this on for us, and we definitely hope to do more of this in the future. So if you'd like to follow both of those organizations, obviously they're on social media, and you can go to their website to see what other events they have coming up. I think that wraps things up, and thanks everyone again. Appreciate it.